I think so. I think AI is going to be the wave of the future. I think combining this lifestyle medicine with the artificial intelligence to, like we talked about earlier, there are so many variables in the human physiology, in the environment, in our mindset, in our microbiome, that it's almost impossible for a physician to account for all these factors. And so we're going to need technology to help us interpret all of these data points.
All right, everybody, welcome back to another episode of the Wellness Cafe. Today, I'm sitting here with Dr. Scott Jacobson, the founder of Wishing Wellness Medical. How are you doing, Dr. Scott?
I'm doing great, thank you.
Thank you for coming today.
My pleasure.
So today, I just want to kind of dive into your story a bit, and we're going to be talking about functional medicine, turntable health, a lot of different topics, and
Sure.
also your vision of what healthcare may look like in the future.
Sure.
So for those who don't know you, give us a little bit of a backstory.
Sure. So my name is Scott Jacobson. I'm a family doctor. I did my residency training here in Las Vegas, and I worked in a traditional primary care setting for 2 years after residency, and I got burned out really fast. At 2 years in, I was done with fee-for-service medicine. So, the traditional medical model right now is absolutely broken. There's no question about that. Doctors are getting burned out at higher and higher rates, especially primary care is one of the toughest to make a living at, unless you're employed by a big hospital group. And even in those cases, I was seeing 30, sometimes 40 patients a day. I was still being told every month by my boss, you gotta see more patients, you gotta order more tests. We did a lot of ancillary testing, labs. We had a lab in-house. We had echocardiograms. We had EKGs, X-rays, ultrasounds, all these things that were generating revenue for the company. And the only way to make it work was order more tests, do more stuff, see more patients. And I'm like, that's not why I went into medicine. That's why so many people are getting burned out in medicine these days, because you have a choice. You can either make money or you can provide good care. There's no way to do both. You cannot see 30 patients a day and provide good care to all of them. And if you're only seeing 15 patients a day, you can't be in a solo practice. It will never work. The overhead is way too high. You have to be employed by a big physician group, which really you're then giving up any autonomy that you have.
Right.
Which I think a lot of doctors want some autonomy. And so I was over it after 2 years, and I started looking around, and I ended up being hired by a company called Iora Health, who really had a vision to change the way healthcare was delivered. And I spent 5 years working for them. Initially, I was working for a clinic that was contracted with the culinary union here in Vegas. So the casino workers, the maids, the kitchen workers, the people who clean up on the casino floor, a mostly immigrant population, a lot of non-English speakers, very low educations, many illiterate patients. And these patients were all had to, in order to qualify for this clinic, had to have chronic, uncontrolled medical conditions. So 60% were uncontrolled diabetes. Many had heart disease, end-stage renal disease, complications of diabetes. And many of them were on 10, 15 different medicines. They were seeing 6 or 7 different specialists. There was no communication between any of the specialists. They were on, they would be on 3 or 4 different beta blockers because they didn't know what medicines they were on. They would go in, they're not taking them. They would have high blood pressure, so one doctor would add another medicine, and they would go to the nephrologist. Oh, your blood pressure's high. Here's another medicine, and they would just come in with bags and bags of medicines, and nobody was coordinating the care. Nobody was talking to each other, and the patients were suffering. These patients were absolutely, and still are. There's many people who don't have the health IQ that they need in order to take care of themselves. And when you have a primary care visit that's 10 minutes long and you have to review a chart that's this thick, back in the days of paper charts, which is
right, a stack.
Yeah, exactly. Yeah. Or a stack of records. It's impossible to provide good care. And so what primary care doctors were forced to do, or in the fee-for-service world, is punt to a specialist every time, because I don't have time to figure out what's going on with your heart disease or your diabetes. I don't have time to take care of it, so just go see somebody else.
Right.
It's faster for me to do a referral than it is to talk about, hey, let's change your diet. You need to reduce the amount of carbs you're eating. You need to count, how much sugar you're taking in, and you need to check your blood sugar. And somebody needs to follow up with you and adjust your medicines and figure this out. And there's just not time to do that.
Right. You're basically going from room to room.
Yes.
And there's no time for
Absolutely.
any type of proper interaction or
Absolutely.
proper doctor-patient rapport.
Yes, absolutely. Oh no, that's huge. So you're not building relationships with patients; they're just cattle herding in and out. And so I was very lucky to work for this company, Iowa Health. Their mindset was really, we need to change the way healthcare is delivered. And their model was a team-based model where we had health coaches. We had mental health specialists, social workers in the clinic with us, working every day to help with the patient. So building these relationships. So we'd have health coaches who would come in and spend 30 minutes with a patient, gathering all that information, and then huddling with the rest of the team, the doctor, the mental health provider, and working with them to work on all areas of health, including the social determinants of health, which are huge, can make huge impact. If somebody doesn't have a bed to sleep in, if they can't afford food, if they don't have the basic necessities they need to take care of themselves, how can they take care of their health? That's impossible. So having all of the support, and we made huge impact. We were reducing ER visits by 40%, urgent care visits by 40%, decrease in hospital stay length, because we were there, talking to, I had time to call the hospitalist when our patient was hospitalized, give them all that background information that, they're not going to get from the patient.
Now, is this the same organization or the clinic system that you treated the chronically ill patients?
Yes.
So basically there was like a change in the way.
No, so initially I was with a fee for service,
right,
and then I started with IOR, and I was working with culinary. So after working the fee-for-service world, where I'm seeing 30, 40 patients a day, I went to seeing 10 patients a day of chronically ill patients, but getting to spend an hour and a half with patients, and really getting to know them, building those relationships, and really saw a huge impact on not only their outcomes, but their overall well-being, how happy they were, which is a indicator of how healthy they are. If people feel like they have power over their health, feel like they understand their health issues, they're going to have better outcomes. And so that was really what we focused on, was trying to create an environment where people could take care of their own health. Which was a big challenge. So I learned a ton managing chronic disease, managing people who've already done so much damage to their body from poor lifestyle, that we can make a small impact, but we're never getting them off all their medicines.
Right.
And so that it was a really fulfilling job, and I loved doing it. But I started to feel like, I think we could do more. I think we can really make a bigger impact by never letting people get to this point, by teaching them the tools. And that's how I got interested in functional medicine. So I started, I'd always been, interested in, holistic integrative health. I considered going to acupuncture school prior to medical school, but always, kind of wanted that, I enjoyed the science background and really wanted to get that Western medical degree, but always thought I would love to go back and do some more holistic care. And when I found functional medicine, it was exactly what I was looking for, because it maintained that scientific background, the basic sciences, but yet used all of that knowledge from ancient wisdom, from traditional medicines throughout the world, and kind of looked at how that integrated into our scientific thought and how we understand physiology and genetics and nutrition and the microbiome and all of those things.
So just a quick break. Tell our audience who have never heard of functional medicine in this term before, because right now it's getting more and more popular these days.
Yeah, no, I think there's definitely a lot more people who are looking for this type of care. They're tired of the traditional medical system because it's a system in which people get a pill for every ill, right? So you have a symptom. That's what Western medicine is we're really good at identifying what the problem is and what's causing those symptoms, and then giving you a drug to ameliorate those symptoms. So if you have a stomach problem, you have gastritis, what do we do? Well, there's too much acid, so we give you a medicine to reduce the acid. You have a breathing problem, so your airways are tight because you have COPD or asthma. We give you a medicine that relaxes the airways. You can breathe better. If you have rheumatological problem, you have joint pain, swelling, rheumatoid arthritis, lupus, your immune system is overactive, it's attacking its own body. What do? Give you medicines to suppress the immune system. So all of those things, so that's the Western medicine approach, and it's very helpful a lot of times, but a lot of times it doesn't give people what they need. They're continuing to have the symptoms unless they're on the medicine, or they're having huge amount of side effects that make the medicines intolerable to them. So they're not able to get the benefit from the medicine. So what functional medicine does is say, wait a second, why is somebody not producing enough acid or too much acid? Why is somebody's immune system attacking their own body? Why are people have reactive airway disease? What's causing their asthma or their eczema? What's driving it? Like, we know the pathophysiology of what's happening, and we can target drugs to stop those things from happening, but what can we do to stop it from the first place? So that's what functional medicine does. And the reason why functional medicine kind of has a bad rap in the Western medical community is because it's very hard to do studies on the functional medicine approach. Because the functional medicine approach says you're categorizing things as a disease when it's really just a constellation of symptoms, right? But the disease process, the pathophysiology, may be different in different people. So, for example, migraines. Migraines are something that we don't really know what causes it. We know that there's probably some inflammation in the brain or some excitability in the neurons in the brain, but we don't know what causes it. We know there's a ton of medicines that we can give to help it. But in functional medicine, and I've seen this in my practice, is if you make some slight dietary changes, you can eliminate headaches. I've had people who've had headaches daily for 20 years. They eliminate gluten, and their headaches disappear within a couple weeks. And so, but is gluten the problem in migraines? If you did a study and just eliminated gluten, would it be helpful? Probably not. Because there's 100 other pathophysiologies that may be driving it, right? And so, functional medicine looks to not only, diet, nutrition, sleep and relaxation, fluids, hydration, the microbiome, past trauma, physical, emotional, sexual trauma in the past. The microbiome is a huge one. It's how the gut bacteria interact with our body, and how that can influence our physiology, our genetic expression, the epigenomics. So all of these things, all contribute, and it may not be just one thing in a person. And that's why doing a randomized controlled trial, you're not going to be able to tease out those different things.
I completely agree, because even though we know a lot, we know way more than what we knew 50 to 100 years ago, but still, there's probably hundreds of millions of pathophysiology that's going on at the micro nano level that we don't even realize.
And the other problem with randomized controlled trials is you're looking at one factor. Right? And like you're not, we try to control for as many factors as possible, but the fact is there's hundreds of thousands of factors we're not controlling for when we do a study. So to say that,
it's impossible.
You can't. Well, and so all we can do in functional medicine is look at the basic science, look at the rationale for what we're doing and try it and see if it works. The thing with functional medicine is it's extraordinarily safe. You're not going to have, really adverse events from going gluten-free. Or supplementing micronutrients, in a reasonable way. Herbs, can cause some bad side effects, but compared to pharmaceuticals, not very severe adverse or serious adverse events.
So basically, it's looking at the human body with a different lens, essentially,
Absolutely.
right? And asking the big question, why? Why is this happening? Why is your high? If your blood pressure is high, why is your cholesterol high? Why do you have chronic joint pain?
Sure. 85% of hypertension is essential hypertension. It means we have no idea why it's there, right? But I guarantee there's some pathophysiology driving it, right?
Yeah.
What is it? And functional medicine looks to answer that question. What is that pathophysiology driving it?
Right, and the holistic approach that look at the body mind as one thing instead of separate.
Yeah, absolutely.
Because we get stress from our past, our present, and also our future, and
for sure
that induces the stress response in our body, and it can trigger a whole cascade of events.
Oh, absolutely. So inflammation is a huge part of functional medicine. What is a big driver? I mean, we know inflammation is a driver in diabetes, in heart disease, many other all the inflammatory conditions, all the rheumatological conditions. Autoimmune diseases are now on the rise and huge. And when you put them all together, they're more common than heart disease and diabetes and all these things. So it's absolutely imperative that we start looking for those drivers of inflammation and trying to eliminate as many as we can.
Right, and I think this is the best time to be in functional medicine, and also because the population is fed up with the old paradigm, the old system that is expensive, that is so harmful, and is not working. Right, ineffectiveness and inefficient. And really, I think that it's the people is waking up to it.
No, absolutely. No, people want this type of care. People are definitely fed up with Western medicine. It works for a lot of people. There's no question about that.
Absolutely.
It's a lot easier to take a pill than it is to change your diet, to start exercising, to start meditating, start going to yoga classes or Tai Chi classes. I mean, that takes commitment and time and energy, and people often just want a pill.
Right.
But more and more people are saying, hey, can you offer me something else? These pills, they make me feel terrible. They give me side effects, and they're not that effective. Or they want to know that answer to that question. What is driving it? Why do I have this? And what I see a lot of really brilliant specialists, telling their patients, that, oh, I don't know, or what diet should I take? I don't know. There's nothing. Diet's not a factor here. And it's not that they're they're not intelligent. They're just not informed, and they haven't seen, yes, a lot of it's anecdotal, but I've seen people make such huge changes in their health just by changing their diet and their lifestyle that I'm convinced that it's diet is the major driver of chronic disease.
And the worst thing is they believe it.
Yes.
They go to this orthopedist and they were told this. So now their reality changed. They're disempowered because they realize, the doctor just told me nothing can help me.
Yeah. The only thing that's going to help me is this surgery or this pill.
Right. I'm going to take these 3 medications and more for the rest of my life.
So. Yeah. And that's not necessary for everybody. So when I was working with the culinary patients, I started to see that we could be doing more. And I started doing a functional medicine group for patients. So it was free for all the patients there who were patients in the clinic. Once a week I would come, I would talk about diet, I would talk about supplements, I would talk about how to manage chronic disease without medicine. And it was hugely successful. And I saw patients who were motivated really were able to make changes. But I also found that pushing this on people who aren't interested in it was not effective. There has to be some buy-in. There has to be some motivation of the patient, because these, I can show people the way, but they have to walk the path themselves.
That's right.
Right. You know, and so, when I started at Turntable Health, it was the same model: health coaches, mental health providers, team huddles every day, talking about patients, talking about the patients we're most concerned about. But it was a different population. It was a healthy population. It was a lot of the downtown project employees.
Zappos, right?
Yeah. And well, we didn't end up seeing Zappos patients, but Tony Shea was the original benefactor and built out the clinic and worked with us for a long time. And so and he was on the board at IORA for a while. And so
what year was that?
That was in 2010 or 11.
Yeah. Okay.
Is that right? No, 2012 and 13, I think.
I see.
Is when he was on the board.
Right.
And so that young, healthy population presented with a lot of different complaints. So they didn't have diabetes yet. They didn't have heart disease yet. But what they did have? A lot of stress. A lot of poor diets, a lot of alcohol and drug use, a lot of anxiety and depression, and poor sleep. A lot of stress at work. And what I found with these people is they were really receptive to these functional medicine concepts and ways to promote health, and they had a lot of buy-in, and you could see huge benefits. And it also helped having health coaches and mental health providers there, because mental health is a huge part of physical health. And our brains, our minds are so powerful in healing ourselves. That's why I love Tai Chi and yoga and meditation, because Tai Chi is medicine. It's medicine that your body makes, and you can heal yourself with these simple movements, and it's really easy to learn. I teach medical Qigong. I was teaching at Turntable for 3 years, and before starting my own practice, and now teach for my patients at Wishing Wellness. And so I've taken a lot of the concepts I learned at Turntable and taken them into Wishing Wellness. And Tai Chi is definitely one of them. I love Tai Chi because it's really easy to learn. It's something you can do at home, and it's medicine that you can make for free. Your body, it takes that ancient wisdom of traditional Chinese medicine, and it uses a lot of breathing, meditation, simple movements, mindfulness, and visualization. So really, using the power of your mind to improve your health.
What do you visualize?
So there's tons of things. So I can give you a whole talk on medical Qigong. So Qigong it's like Tai Chi is really a form of Qigong.
Right.
Qigong is it was developed thousands of years ago in China. People were doing it for the health benefits. So they found that you do these movements, you can stay more healthy. And then over the years, it became co-opted by, as Buddhism came to China, they said, if we use these techniques, that you can get spiritual enlightenment. That's great. And then 500 years ago, they said, oh wait, if we use these in martial arts applications, we can become powerful warriors. And these techniques were highly secretive. People were trying to, they didn't want to share these secrets because they were so powerful in hand-to-hand combat that, they didn't want to share it with the general public. So, so now, in the last 100 years or so, Tai Chi became, back to being for health benefits. People don't use it for martial arts, even though it is a martial art. it's really, the movements are slow and meditative, and, really there's tons of evidence that it's helpful for anxiety, depression, PTSD, chronic pain, all these things, balance in elderly people, it's preventing hip fractures, all these things. But so back to the visualization question. So what I teach is medical Qigong, and medical Qigong is not the martial arts form of Qigong, but the health form. And it's a branch of traditional Chinese medicine. Much like in traditional Chinese medicine, they use herbs or acupuncture to help strengthen the qi or life force energy in each of the organs of the body and clearing out any blockages of qi. So the visualizations that we do are a lot about visualizing the different colors and tastes and emotions associated with each organ, and imagine the clearing out or strengthening of the different things. So I go through a whole program where it's about a 30 minutes of what's called the 8 sections of brocade. It's a very old set of exercises that works every organ in the traditional Chinese medicine system, and there's different movements, breaths, and visualizations to go along with each one.
That's really cool. Like you're taking all these concepts that you learn in functional
Sure.
medicine and apply it to your patients.
Sure, no, absolutely.
What are the results?
So I have patients who, I have a 79-year-old patient who's been with me for about 3 years learning Tai Chi, and he's had serious knee problems and wasn't able to get out much, wasn't able to really leave his house, and
Right.
he's been doing Tai Chi with me, is now able to be more mobile, able to get out of the house. I've had people who have had serious trauma and both emotional, and it's really helped them work through that trauma. I've had people who chronic pain is a huge one that people see a lot of benefit, but a lot of anxiety and depression.
Right.
It also builds community. You have people coming out, getting together, talking to people, meeting people that especially in the elderly population, people who don't they don't get out much, they don't interact with a lot of people, so you're getting them socializing, which we know has benefits in overall health. So
Yeah, because we're social animals.
Yeah,
essentially.
absolutely.
Yeah, and Tai Chi, even though it's not as popular here, but on the other part of the world, like China,
Sure.
in the parks in the morning,
Sure.
there are all
Sure.
those people coming out and just doing Tai Chi.
Even here, there's many parks around the city where you go in the morning and you see people practicing, and there's a lot of classes. There's a lot of it's not as popular as yoga. I think yoga is great too, and I think one of the things there's hundreds of different styles of Tai Chi. There's hundreds of different styles of yoga. There's different types of meditation. So I think there's a form out there for everybody. So it's a matter of finding there's forms of yoga that I can't stand. For me, my personal practice, I don't like them. But there's other ones that I loved doing, and
Right.
and so and it's much like the functional medicine approach to diet, which is there's not one right diet for everybody. You have to find one that's perfect for you, and it's the same thing with these mind-body practices. Finding one that's right for you.
Right, and some of these forms can be, I want to say, perverse. Like, I don't know if you heard of beer yoga before, where they actually do yoga and drink beer at the same time.
Yeah.
So it's like, well, it's
Sure.
at that point it becomes a fad, not so much.
Sure. I mean, and it's the same
yeah.
thing with boat yoga or a paddleboard yoga or these things. And
Right.
hey, my feeling is with these things, yeah, they may be fads, but you're still getting out and socializing. You're still,
still stretching.
So, yeah, exactly. So there's probably still some benefit. It's better than not doing anything. That's what I always say. It's like, even, one of my Tai Chi teachers, said, with all these forms, because it's a very traditional practice, and there's some teachers who are very rigid and you must do everything this way. But my personal belief is, all of these, exercises were made up by somebody at some point, and they gave them benefit, and they saw that their students got benefit. But pretty much, even if you're doing it wrong, it's better than not doing it at all.
That's right.
And so even if you're getting a little bit of benefit, I think that's great. The more, you can study it for years and years and years, and incrementally getting more and more benefit out of it. But again, even doing a little bit is better than doing nothing.
Absolutely, and yeah. So let's shift gear a little bit.
Okay.
Let's talk about direct primary care.
Sure. So
before I visited your website, I've never heard of it.
Yeah.
So what is direct primary care and how is it different?
Sure. So, I practice functional medicine, but I also do traditional medicine because, again, a lot of people, that's what they want. And I still think I can make a big impact in them, by, pushing these, maybe non-traditional ways of thinking about health, but still giving people what they need. And sometimes that is pharmaceutical medications. So I wanted to be able to provide that. And I didn't want to have to be beholden to insurance companies and documenting and billing and coding in a certain way. So what direct primary care does is takes out the middleman and says, I don't want to be a part of that insurance system. I want to be outside of it. And the way I found to do that, and what we did at Turntable, and really the IORA model, is really get paid per member per month to take care of them. Whether you see them once a month or 0 times or 10 times in a month, pay a flat fee and provide these services. And not have to say, we're not going we can't tell you your results over the phone because, I'm not going to get paid for that as a doctor, which in a traditional primary care office, you can't get results over the phone. Nobody's going to give them to you over the phone because you can't bill for it. So, this is what direct primary care, says. It's like if I wanted to spend 20 minutes talking to somebody about nutrition or diet counseling or lifestyle counseling, I have the ability to do that. Or I can have a health coach do it, or a certified nutritionist that I work with do it. And still be able to provide these services, but not be beholden to billing and coding and, checking off 10,000 boxes just to, to have everything in the note that needs to be there so that it can be billed for a level 4 visit. And, when you get these records, it's garbage. It's just absolutely garbage. You can't read, you can't identify any medical decision making in the note whatsoever. They're copied and pasted. They're garbage. And the only reason they're like that is so the insurance companies can justify payment. And so I didn't want to have any part of that. I said, I want to be able to take care of patients how I think is best, and let people decide whether that's worth it or not. So my patients pay a monthly fee, $149 a month. I provide all these services, these classes, nutrition counseling, mental health services can be purchased on top of that. But if somebody wants this type of care, they know that they have a doctor that they can build a relationship with, that they can text message or email if they have a question, and they'll get a timely response. They don't have to sit in urgent care for hours because I have same-day appointments. I'm able to get people in when they need it instead of punting to an urgent care every time because you can't get in to see a regular doctor for 4 to 12 weeks. I mean, it's not uncommon in this town, especially, to have a 12-week wait to get in to see your primary care doctor. Right. So if you have an acute problem, you're not seeing your doctor. The person you're seeing is going to have no idea, or they're just not going to go, and then they're going to get really sick and they're going to end up in the ER. So you're driving up healthcare costs because you're not paying that extra money up front for primary care, which is really what we should be doing. 80% of healthcare spending is outside of primary care. It's specialist care, hospitalist care. And so that means 80% of care is failure of primary care. Right? Yeah. If we can just make a small dent in that, then we're actually saving the system money, and we're able to provide really good care that people want. People want this type of care. They want to be able to know who their doctor is, know that their doctor knows who they are, and be able to access them whenever they need it, and not just 3 months down the line.
Now, is more primary care doctors shifting to direct primary care?
There, in the United States right now, there's about 500 direct primary care doctors. Okay. So it's a very small movement right now, but it's gaining steam, and there's more and more every day. It is sometimes confused with concierge medicine. Right. Concierge medicine is a similar concept. The main difference is they still bill insurance companies. So they still have the billers and coders and are beholden to their rules for documentation and for billing and all of those things. And it really, so it requires a big apparatus to have, to have a concierge clinic. Whereas in direct primary care, where as I said earlier, traditional fee-for-service model, if you want to go out there and be on your own and have your own practice, you are going to have to work your butt off. You're going to have to, work evenings, weekends, just to break even, because the amount you're getting paid from insurance companies is so minimal. Whereas in direct primary care, the startup costs are so minimal. I sublet, some offices. I pay for an electronic medical record system and a billing system, and my overhead is super low. And just opening right off the bat, I haven't had a month where I lost money. Which is very difficult to do in a medical practice right off the bat when you're starting from scratch with 0 patients. And so it's a model that is reproducible. It's very high patient satisfaction, which is a metric that is pretty controversial. In my feeling, we shouldn't be measuring doctors on patient satisfaction, but if we can provide good medical care and have good patient satisfaction, that's the goal, right?
Win-win.
The problem with patient satisfaction surveys is patients are only satisfied if they get the antibiotic that they don't need, right? And so if you're just basing it on patient satisfaction, you're not necessarily providing good medical care. We should be assessing doctors on, are they providing care that is safe, effective, and reasonable. And I see in this town how much abuse there is of the system. I see care that is not needed. Care that is dangerous. I mean, I've seen patients with 25 stents in their heart, and like that is not. Wow. There's no indication for that, and I see people getting stress tests every year for hypertension. No coronary artery disease, just hypertension. They're going to their cardiologist every year and getting stress tests. That is not evidence-based care. Functional medicine is often criticized for not having evidence-based care, but the fact is, the matter is that unless you're in an academic setting, most care that's provided in this country is not evidence-based. Doctors just do whatever they want. And that oftentimes, especially in these big hospital systems where they're giving ER docs and even primary care docs, they're rating them based on their patient satisfaction scores. And if they're not doing what patients want, then they're not getting good scores. I mean, there's hospital systems who are making quotas for admissions, and this happens all the time. And it's like, it doesn't matter, if the patient needs to be admitted or not. The ER docs need to admit a certain percentage of patients that come through the door, and that's a symptom of this fee-for-service model that we have. People get paid more. Hospitals make more money if they admit more patients. So it doesn't matter if they need it or not, they're going to admit them.
Sounds like a gigantic mess.
It is. It's a huge mess, and that's why people are frustrated, because they see that they're not getting the care that they really deserve.
But again, as we mentioned in the beginning, I think the public is waking up to what's true health is.
Sure.
There's more organics availability. There's more restaurants that are actually promoting gluten-free or more grass-fed type meat. Yeah. And there's more yoga studios popping up. There's more gyms popping up, CrossFits, everything. So I think that even though it's still a huge mess, it's moving in the right direction.
Oh, absolutely. Yeah. I see the amount of social media posts about people eating healthy. Communities building online. There's a great vegan community here in Las Vegas. There's a great functional medicine community here in Las Vegas of people wanting to get information. So a lot of what I do is providing content. Writing articles and giving posts to teach people how to eat healthy. And it's great, the number of healthy restaurants in Vegas is amazing. It's really great. There are options to eat healthy even in fast food settings, which 10 years ago that was not the case.
Right.
Yeah,
Right.
so it's amazing. Diet is something that I'm super passionate about. Nutrition. I didn't get any nutrition education in medical school and
How much?
residency. So
How much training do you get?
So basically, in medical school, I would say I got like a 4-hour lecture, and then in residency, I got 1 hour lecture per year. And it was the same lecture all 3 years in a row. And it's basically, the fact is nutrition is really hard for doctors because, when you're trying to give evidence-based advice, the fact is there's not good evidence in nutrition. We just don't know a lot because randomized control trials are really difficult to do, right? Most of the nutrition studies are based on survey-based, population studies. So people get asked, how many times did you eat fish in the past 2 years? Well, I mean, how accurate a response are you going to get most of the time? And we know that these are biased. Mm-hmm. We know that people report what they think is healthy. So, for years and years, we've been told that fat is unhealthy. So people are going to instinctively report that they eat less fat than they really do because they believe it's not healthy for you, and they want to feel like they're eating healthy, right? Yeah. And so these studies are inherently biased. So we don't have good information to tell patients. So we basically say, when patients ask, well, what diet should I eat? Most doctors say, I don't know, or stay away from the fat. Eat more vegetables. It's kind of generic advice, which I think is good, but it doesn't give people anything concrete to talk about. So in functional medicine, what I tell my patients is, there's not one right diet for every person. Every body is different. And people are going to tolerate things better than other people. And so what I teach people to do is do an elimination diet. And what that means is eliminating the foods that are the most highly inflammatory. So things like gluten and dairy and eggs and soy and a lot of meats like beef and pork can cause an inflammatory response.
Omega-6 is fats.
Exactly. We know these are highly
fat.
Sugar we know is inflammatory in everybody. These omega-6 fats are inflammatory in everybody. And these so-called healthy fats that that we know drive the pro or the anti-inflammatory cytokines, and we know omega-6 fats drive the pro-inflammatory cytokines. Insulin drives the formation of pro-inflammatory cytokines. So we know eating certain foods are going to drive inflammation. But there's also foods that in some people drive inflammation and some people don't. So gluten and dairy are big examples. Some people develop food sensitivities, let's call them. One of the big criticisms is gluten allergy is a bunch of bull. There's no evidence that it actually exists outside of celiac disease. And we know celiac disease is a specific IgE-mediated inflammatory response, but the fact is you can have a lot of other IgG-mediated delayed hypersensitivity reactions that are low grade and don't cause this immediate reaction that we think of when we think of allergy, right? And so people can have these IgG-mediated responses that that cause low-grade inflammation systemically. And then, in susceptible patients, in one patient that may cause headaches, or it may cause eczema, or allergies, or asthma, or a whole host of other things, irritable bowel syndrome. And by eliminating these, the highly inflammatory foods, we can see when we reintroduce them what are their symptoms. So I teach people to do, food diaries. I take people, say, okay, what did you eat? Let's try eliminating this for 3 weeks, because those IgG antibodies can hang around for 3 weeks in the blood. And so by eliminating them, we can say, really clear those from the system, and then see what your symptoms are like. Do a symptom diary. How many times did you have migraines since you've been doing this elimination? Did they decrease over time? Let's try adding back gluten. Let's see what happens to your headaches. Do they come back? And that's really the best. There's all kinds of other allergy testing that we can do, but the gold standard. And I try to minimize testing. I think testing is wonderful in functional medicine, but it's not perfect. We're in this very early stages. So I like to try to do as much as we can without doing any testing. Because you can see a huge difference just by making lifestyle changes in a good 80 to 90% of people.
Right.
And then we reserve the testing for those people where it's not,
right.
we don't know.
Like, let's say if somebody comes in, well, if you cut out gluten, cut out dairy, and cut out most of the sugar, then 80 to 90% of the time, the symptoms improve.
Yes,
whatever
exactly.
Initially they came in with depression, anxiety, maybe even acne, or
absolutely.
IBS, those can improve just like that.
Sure,
Yeah,
absolutely.
So.
I mean, so there's a lot of controversy. I mean, paleo is a lot of, mostly what the Elimination Diet is an autoimmune paleo diet, which, is really eliminating those highly inflammatory foods. It can be more restrictive. Eliminating legumes, for example. A lot of people do really well with legumes, but in the very strict elimination, I like to try to eliminate them for 3 weeks and see what happens when you add them back in. But again, it's very much I individualize diets with people because eliminating gluten, dairy, legumes, sugar, and alcohol and caffeine all at once is a monumental task. It's really, really hard. And if people are willing to do it, I will help them put together meal plans and help them do it. But a lot of times people like to say, I'm going to start with dairy and gluten and I'll do that. I always tell people sugar and inflammatory fats, definitely you have to eliminate those. And then, maybe do, gluten or dairy on top of that.
Kind of meet them where they're at.
Exactly.
How much ready or committed
I do a lot
of
shared decision making, and
yes,
it's explaining to people, and with my direct primary care patients as well. I always do this. I'm saying, look, you have migraines. Let's talk about the different options. We can do butter burr, which is an herbal prophylactic medication. We can do Topamax. We can do propanolol. We can do all these different pharmaceutical prophylactic medicines, or we can work on your diet. These are the risks and benefits of each one. Which one do you think is going to be the best for you? And really putting that out there and helping them make that decision in an informed way, knowing what the risks of taking Topamax are, or what the risk of these herbal medications, or how can I help you make this diet work for you?
Right, use the medications as a crutch.
Yes.
So they can get from point A to point B, and after that have a plan or a system to take them off of it, right?
Sure, exactly.
Cool.
Yeah.
That's awesome, man. I think we can go for another hour or two. But
I love talking about this
I
stuff.
know. I can totally see this. How much passion you have for what you do. So this is awesome. I have a fun one for you.
Sure.
What do you see or what do you think is going to happen in the future with the introduction of nanotechnology, AI, and smart computer, and the immersion or the integration of technology and medicine? I think
AI is going to be the wave of the future. I think combining this lifestyle medicine with the artificial intelligence to, like we talked about earlier, there are so many variables in the human physiology, in the environment, in our mindset, in our microbiome, that it's almost impossible for a physician to account for all these factors. And so we're going to need technology to help us interpret all of these data points. There's just too many for us. And so I think artificial intelligence is going to be able to allow us to input somebody's genome, do a microbiome screen and put in all of that data, and then all the medications they're on and how all of those things interact, and be able to give us really succinct treatment plans based on that. And then the doctor's job is still going to be how do we implement those, right? But being able to be able to process all that data is going to be hugely important, and I think that's the wave of the future.
I completely agree on that one. I think that the old system is going to slowly die because of the introduction of AI.
Sure.
Just because, let's say you do a conventional blood test right now. Let's say there's 30 to 40 variables.
Sure.
people still miss them when they go through reports, right? So
All
human
the time,
errors
yeah.
is huge.
Yeah, absolutely.
And with AI coming in to help with that, it's going to help eliminate a lot of that diagnostic portion.
Sure. Yeah. No,
Very
absolutely.
cool. Where can people reach you and find you if they want to learn more about you?
Sure. So you can find me at my website, wishingwellnessmedical.com. Also on Instagram, Wishing Wellness Medical. Facebook, Wishing Wellness Medical. So all social media and our website. You can sign up online. You can sign up for a newsletter where you get updates with some of the articles that I've written, or other helpful articles, diet, recipe ideas, all these things. So
cool. And what's your, let's say if the audience out there listening or watching, where should they go for more information on learn more about functional medicine?
Sure.
What's your favorite resources?
There's a lot of resources out there. I mean, all my favorite, functional medicine docs out there, Dr. Mark Hyman, William Davis, David Perlmutter, Kelly Brogan, all have great books. Frank Littman's another one. All of these have great resources. They all have their own, meal plans and supplement plans and all these things, but they also all have a lot of, on their websites, lots of articles about, different, aspects of functional medicine.
Right, and just to kind of go back to the point, and I think this is exploding functional medicine. Just look at, I want to say, like the book sales. Yeah. These doctors' book sales on these different topics.
Sure.
20 years ago, probably not going to be as big.
Yeah, no,
right?
absolutely.
But now everybody's like, oh, this is a great book.
No, absolutely. I mean, I like Alejandro Junger is another one that I really like what he's done. And what I like about all these people that I mentioned, they all come from different, they're all MDs and they all have come from different medical specialties. And what I love about their books is they kind of compile all this research on their specialty. How functional medicine can treat psychiatric problems, or neurological issues, or gut issues. And the amazing part is the treatment is identical in all of them. It's really looking at those root causes. You can cure depression, or heart disease, or diabetes, or all of these different chronic diseases. But the all their protocols are virtually identical.
Yeah,
and it's functional medicine. But it really comes down to having an experienced practitioner to kind of wade through and say, okay, what root cause do we need to work at? Is it toxins? Is it the microbiome? Is it the stress in your life? How can we figure out what you need and what the root cause is, so we can turn down your symptoms and turn down that inflammation.
Cool.
Yeah.
So the name of the show is called The Wellness Cafe.
Okay.
Your medical practice is called Wishing Wellness. What does wellness mean to you?
Yeah. So that's I think. Wellness is the absence of disease, and so I after spending 5 years working with very chronically ill patients, I learned that my passion was keeping and maintaining wellness. I really think that much like the traditional Chinese medicine doctor was always paid to keep people well. Right? It wasn't, you didn't go to the doctor when you're sick, you pay the doctor when you're well to keep you well. And that's always my goal in Wishing Wellness is to keep people out of the hospital, keep people well, so they don't need pharmaceuticals. I'm there for them if they need it, but what I advocate is for living a healthy lifestyle, so that you can stay well and avoid chronic disease.
Dr. Scott, thank you so much for joining me.
My pleasure. Thanks for having me.
So guys, please go ahead and check out Dr. Scott's Facebook page, website, and everything. Like it and share this message so that more people can learn more about functional medicine and what it's like to have and achieve true health. And if you haven't subscribed to this Wellness Cafe podcast, go ahead and go to iTunes and subscribe. And also we are going to be on YouTube too, so check it out there.